Good morning all. My presentation topic is dry eye evaluation in thyroid eye disease. Aim of my study is to evaluate the dry eye in patients with thyroid eye disease using various tests of dry eye. Dry eye is a common association of thyroid eye disease and a common cause of morbidity. So in patients with dry eye symptoms, ophthalmologists can play a primary role in diagnosing the thyroid disease, and hence dry eye evaluation is very relevant in such cases. Considering the consequences of dry eye, it is important to prevent these complications by diagnosing and treating the dry eye earlier. All patients diagnosed with thyroid eye disease presented during the study period were selected for my study, and patients with allergic ocular surface diseases, duct abnormalities, contact lens users, pterygium, pseudopterygium patients, patients on topical anti-glaucoma medications, those with other systemic diseases causing dry eye were excluded from the study, and the subjects diagnosed to have thyroid eye disease attending ophthalmology OPD of Government Medical College Kottayam during a study period of 1 year were included, and these patients are documented thyroid disease patients irrespective of their thyroid status with lid retraction and any of the features like a restriction of extraocular movements, exophthalmos and optic nerve dysfunction. We totally got 91 subjects during the study period, and all underwent a sequential history taking, detailed ocular slit lamp examination and dry eye evaluation tests like Schirmer test 1 and 2, tear film breakup time, ocular surface staining and impression cytology. Dry eye was diagnosed in those with subjective symptoms of dry eye and any one of the positive diagnostic tests, Schirmer test less than 10, tear breakup time less than 10 seconds, impression cytology grades according to the Nelson criteria more than 2 and 3, and Rose Bengal stain with the Van Bischoffer score more than or equal to 4. Results of my study: the prevalence of dry eye in thyroid eye disease was found to be 63.7%, and among 58 subjects diagnosed with dry eye in thyroid eye disease, 68.1 were females and 31.9% were males. The Schirmer test results shows 96% of Schirmer 1 was normal, and in 4% subjects it was abnormal, and Schirmer test 2 was normal in 82% of the subjects, and in 18% it was abnormal. About the T-BUD test results, among total subjects of thyroid eye disease, 60.4% had abnormal T-BUD values. Of this, 39.6% had marginal dry eye disease and 20.8% had definitive dry eye, and T-BUD was normal in 39.6%. Rose Bengal staining result study revealed 58 cases of dry eye had a Bischoffer score more than or equal to 4, that is positive, revealing 100% of cases with dry eye had a positive Rose Bengal staining. Impression cytology results shown among total of 91 subjects, 53 subjects, that is 58.3%, had abnormal findings in impression cytology, and among the dry eye disease diagnosed ones, it is 91.4%, which have decreased goblet cell density, decreased NC ratio and desquamation. The prevalence of dry eye disease in thyroid eye disease in my study was 63.1%. And in a study conducted by Jessica H. Selter, the relationship between Graves' ophthalmopathy and dry eye syndrome, the prevalence was 65 to 85%. And in a study by Novak et al., the dry eye symptoms were present in 85% of thyroid ophthalmopathy. In this study, 93.1% had normal Schirmer test 1 and 70.7% have normal Schirmer test 2, suggests that tear production is not much affected. But in Novak study, the Schirmer tests were significantly lower than compared to the control group. Similar result obtained in study by Jessica H. Selter. On analyzing the result of T-BUD, among all cases, it revealed 55 cases with abnormal T-BUD, of which 62.1 had marginal disease, dry eye disease, and 32.8 had definitive dry eye. In study by Jessica Seltar and Extin et al., similar results were obtained. On analyzing the results of impression cytology, among 91 subjects, 53 had abnormal findings. In study by Extin et al., impression cytology in Graves' ophthalmopathy and dry eye patients showed a reduced goblet cell density, reduced nucleocytoplasmic ratio, excessive desquamation in conjunctival cells compared to the normal controls. My references are these.
So every patient had all these 4 tests.
Yes, madam.
What's the order in which you did these tests?
First Shermer test 1 was done. Then tear film breakup time and Shermer 2 was done.
I think once you do the Shermers and then you do T-BUT is acceptable?
No, T-BUT is done, then Shermer 2 is.
That should be the order. And did you correlate it with the clinical activity or VISA score?
Madam, in this study, I only proceed with the dry eye evaluation alone.
Agreed, but you are seeing the patient as a whole, then you know that what was the severity of the thyroid eye disease they were having, isn't it? Every patient will have this score.
In patients with active disease,
To say, is there any correlation between the severity of the dryness to the activity score?
this was positively correlated. In this part, only the evaluation of dry eye was done.
You didn't correlate that with the severity of the thyroid eye disease, no?
I know, madam.
No, that should be.